On episode 686 of the 40 Plus Fitness Podcast, we meet Dr. Julius Birnbaum and discuss his book, Living Well with Autoimmune Diseases, a rheumatologist's guide to taking charge of your health. Welcome to the 40 Plus Fitness Podcast, the largest and longest running health and fitness podcast dedicated to people over 40. Whether you're looking to lose weight, get stronger, or improve your health and age better, this podcast is for you. I'm your host, Coach Allan, an online health and fitness coach and author of the Wellness Roadmap. Each week, we dive into practical tips, expert advice, and inspiring stories to help you take control of your health and fitness. If you're ready to look, feel, and perform your best, no matter your age, this podcast is the perfect place to start. Let's get you on the path to a healthier, fitter, and more energetic version of yourself. I hope you'll join us each week, and together we can unlock your full potential. Hello, and welcome to another episode of the 40 Plus Fitness Podcast. Really happy to have you here. I hope you're having a wonderful day, a great week, and just getting healthier and healthier every day. So for me, right now, this week, I'm getting packed up. I'm going to be heading back up to North Carolina for a few weeks. I'll be up there for about 3 weeks, I think. That's the goal anyway, to try to get some more things done on my family stuff. So not totally looking forward to leaving the islands, but it is what it is. So I will be traveling a bit here, getting up to North Carolina. I actually managed to book a trip where I'm flying all in, well, sort of pretty much one day. I'm not spending the night in Panama City or San Jose. So that's good. I'll actually just fly and get there. So it'd be an interesting trip. I hope it all pulls off the way it's supposed to. And the other thing, I've been working really hard these last few weeks to make sure that I get some awesome interviews recorded. And I have to say, there is some good stuff coming over the next few months. So stick around because I've got some really great guests, some awesome books, and I'm just really excited for some of the stuff that we've come through and a lot of the content and podcast episodes that are coming your way. So stick with us. All right, let's get on with this one. Our guest today is an associate professor of rheumatology at the University of Pittsburgh Medical Center. He is the only physician in the U.S. to have completed residencies in internal medicine and urology, as well as complete a fellowship in rheumatology. This allowed him to pioneer a novel clinical program called the Neurorheumatology Clinic. With no further ado, here's Dr. Julius Birnbaum. Dr. Birnbaum, welcome to 40 Plus Fitness.
Thank you for having me. I appreciate having you on your show.
The name of your book is called Living Well with Autoimmune Diseases, a rheumatologist's guide to taking charge of your health. Loved the title. I don't have any of these, but they just seem to be becoming more and more popular. I mean, in a sense, it seems to be happening more and more. I want to get a little bit into that later. But as I got into the book, you're obviously a lecturer. You're you're glutton for punishment, getting 2 residencies in generally related but not really related fields, and as a result, putting yourself in a position to do just this. And so I'd get in the book. It's like just like a lecture. It's like, this is what I'm going to tell you. Here it is. Summary. This is what I told you. And I've always hated that model of teaching. But as I got into your book, I got about halfway through, and I was saying, thank you, doctor, for doing it this way, because this would have there was so much information and so much to learn that I didn't know, that I was just like, I needed it to be taught like it was being taught. That was the way this book was written, was very, very well done.
No, thank you. I appreciate that. Because I think when it comes to autoimmune diseases, they can be thought as somewhat amorphous in nature. So I think that kind of bringing it down to that granular level and, giving it that format, I think that's what I tried to do. So I appreciate it.
You did. And so I was getting into it. I was like, okay, I would be so in the weeds if he wasn't doing it this way. I wouldn't be able to finish a chapter, because I'd just like, what did he just say? And why did he say that? And how does this relate? And then wait, okay. And so and I think the thing is autoimmune diseases are hard. they're hard to diagnose, they're hard to treat, and obviously not very awesome for the people that are suffering with them. What makes autoimmune diseases so difficult to pin down and figure out?
Sure. So, that's a question I get from a lot of my patients. So, if you kind of step back for example, so if you think about strep throat, everyone who has a strep throat is going to have pain in the back of their throat, and that can be easily diagnosed by a throat swab. Everyone with high blood pressure, you're going to go into the doctor's office and you're going to blood pressure cuff, and that's how you get diagnosed. But as you mentioned, like autoimmune diseases are different. So, for example, one lupus patient might present with joint pain. Another lupus patient might present with a rash. Another lupus patient might present with kidney diseases. So each of these individuals are highly dissimilar to each other. And I think that's why autoimmune diseases can be somewhat challenging to diagnose, because they differ in their spectrum between individuals. So what I tried to do in my book is try to show that there are similarities between how these autoimmune diseases are diagnosed. So you need to think about, do you have a requisite set of symptoms? And then once you have that set of symptoms, you funnel it more closely and you say, well, do you have objective markers on your blood work? Do you have objective markers on a biopsy, let's say, of the skin or muscle? So I agree, it could be widely diverse symptoms. But when you think about symptoms and what shows autoimmunity, I think that facilitates understanding about how to diagnose.
Yeah, because the difficulty, as a patient is we're used to here's a problem, here's a pill, here's a problem, here's a surgery. And for most of us, that's our medical care. Here we come in and, we don't know. We know there's a bunch of symptoms. And now it's almost like this mystery that you have to work with your doctor to completely flesh out and understand, excluding all these other things that those same symptoms could exist under, to get down to a point where now this is the defined treatment that's actually customized and going to work for you.
Yeah, I agree. And the one thing I try to emphasize in the book is just like no size fits all. And when it comes to autoimmune diseases, I want my patients to tell me about narratives. So, if you have joint pain, are you a fly fisherman who has trouble putting the bait on the hook? Are you a grandmother who has difficulty holding up their grandchild? So I think that puts and enlivens these symptoms. I think when you do that, you reinforce to your physician exactly what's going on in a very concretized way, and that facilitates helping me understand how to go through the diagnostic process.
So what exactly is going on? Because our immune system is probably one of the most fascinating things about the human body, that we actually have this defense mechanism that can keep us alive, swimming in a world of germs, bacteria, and fungus. So we really do depend on our immune system. We've seen that over just particularly even the last 5 years with COVID. The immune system is a pretty important system to keep us going. What's going on where our immune system now isn't actually taking care of us?
Right, and so that's the basic tenet of autoimmune diseases, that we have an immune system, and the immune system, like you're saying, normally fights off infections. But in autoimmune diseases, they become confused and starts affecting different parts of our body. So it's almost like there's this metaphor, full house of misfortune. And so that misfortune can include, first, a genetic predisposition. The second thing would be some environmental influence. So maybe at a certain point in time, you had a virus, and the virus might not have caused any symptoms, but it helped instigate this process of autoimmunity. And then the third thing is, as you mentioned, there's a cascade of different steps by which the immune system can become confused. So I think those are three things that I would think about. There's a genetic predisposition, there's some environmental influence, such as a virus, and then how the immune system becomes confused. It requires a lot of different steps. So that three-step approach is why I think autoimmune diseases occur.
Now, as you were talking, like you were in the chapter about lupus, and I had a friend when I was young, starting my work life, and he had lupus, and so there'd be like days, weeks that he'd just have to disappear because he couldn't function. This was 30 years ago or more, so he would just have to disappear. He's like, if I have a flare up, I'm I'm done. I can't do anything for days or even up to a week. But as I was reading the symptoms, it would be easy to misdiagnose something like lupus as schizophrenia because you're having hallucinations. And so how does someone like, I mean, obviously we're going to go to a doctor, our general practitioner is going to tell us something, but how can we know there's more than maybe what's coming up on the preliminary diagnosis or tests or reports?
No, so I think that's a crucial step in the diagnostic process because you have a certain set of symptoms like you described. And then let's say it presents like hallucinations. I think that you and your doctor need to go through with very, very great rigor. What am I missing? What am I missing? Is it an infection that's causing this? Is it a side effect of a medication that's causing this? So there's the symptoms and the blood markers that we talked about. But then the next step in the diagnostic process is thinking of a wide cornucopia of mimics of an autoimmune disease that present like infections or medication. So that's a key step in the diagnostic.
Okay. Now I want to talk a bit about fibromyalgia. It's not really an autoimmune disease, but you did include it in the book. And in particular, when we're talking about fibromyalgia, you got into a conversation about pain generators or a lack of pain generators. Can you kind of go through that process so we can understand what fibromyalgia is and why it's included in an autoimmune book?
Sure. And so the fibromyalgia chapter, I placed it after the chapter on rheumatic arthritis, because in rheumatoid arthritis, there's a readily identified pain generator. It's our joints. The joints can become inflamed. The joints can hurt. In fibromyalgia, we hurt, but there's no pain generator. Now, there's research going on as to why fibromyalgia occurs. It's probably nerves that we have, and we use the process of becoming sensitized. These nerves are becoming irritable. So you can't see nerves being irritable, whether they're in the spinal cord or nerves being irritable in the brain. But that's a process. We always say that the nerves are sensitized. It's just that we can't see it on a brain MRI. We can't see it on an MRI of the spinal cord. But, fibromyalgia hurts. It can cause a great degree of distress. So, and it doesn't have that pain generator yet. It occurs in up to 20% of patients with rheumatic diseases. So, you think about lupus, fair number are affected by fibromyalgia and other rheumatic diseases. So that's why I included it in this book, because I think it's very, very relevant to patients with a lot of different autoimmune diseases.
And you said up to 20%?
Yeah, that's right. Up to 20%, depending on where they are in their disease. So obviously recognizing fibromyalgia is important in the treatment of autoimmune diseases.
Now, I guess two of the treatments you talked about are two of my favorite things, exercise and sleep. Can you talk about how exercise and sleep help with fibromyalgia?
Sure. So if you're not sleeping well, you hurt. And we see this in patients, for example. It's very interesting. Patients who come in with fibromyalgia and they might be a little bit overweight. And then you say, well, have you ever been checked for sleep apnea? And a lot of times they're surprised, but I think sleep apnea can predispose you towards pain because you're never reaching that deep sleep states that's restorative and necessary for you to have a pain-free life. And, exercise helps. We all know that exercise induces endomorphins. And if you're not exercising a lot, you're just becoming more inert and you're not moving around a lot. So any degree of exercise that you could do helps with fibromyalgia. And obviously optimizing sleep hygiene in a lot of different ways can help with fibromyalgia.
Okay. What types of exercise would be most appropriate?
Yeah, so that depends upon the individual, depends upon patient preferences. So, for example, if you're someone who finds solace in nature, I'm going to encourage you to go for walks, and I think that's important for your sanity. If you're someone, for example, who has too much joint pain, then I think you try to go into water aerobics. In a pool, it takes the stress off the joints. That water creates a kind of a warm, inviting environment. So I think it depends upon preferences, and I think about what you could do given your autoimmune diseases.
Okay. Now let's jump into rheumatoid arthritis because this is also a very common disease in the area. And I just remember as a kid, I saw someone that had this and their hands were just mangled. And it was the scariest, as a kid, you're afraid of everything that isn't normal or doesn't appear normal or
Right.
what's common. And it just scared me to death. I was like, okay, I never want my hands to be mangled like that. It just, and I know it hurt. You'd had to just based on how it looked. What is rheumatoid arthritis? What's going on? And I mean, it's destroying the joint. So this could be a really bad thing if you're not able to treat it properly.
Oh, absolutely. So what's interesting is my father was a physician. So he passed away, but it was really interesting. So one of the books he gave me was his own physical diagnosis book. So I agree. I had the opportunity to look about rheumatoid arthritis. What was it like several decades ago? And I looked in the book, and it's exactly what you're seeing. You're seeing joints that are mangled, joints that are distorted. So that was the stage, I would say, several decades ago. Most patients right now never get to that stage because we say time is joints, for example. So the second you're diagnosed with rheumatoid arthritis, in that visit, you should be having a discussion with your physician. What treatments am I going to get through? Because what treatments right only do, they not only relieve symptoms of pain, but they prevent irreversible destruction that you can get of joints. So we almost never see those mangled joints anymore because we have such good treatments that could treat rheumatoid arthritis.
So let's go a little bit into some of those treatments. What because I was actually reading one and it talked about there's no alcohol. If you drink alcohol, this is going to destroy. It already could damage your liver, and then adding alcohol is just fuel on the fire. Can you talk a little bit about the treatments on this and how someone would go about knowing which treatment was the right one for them?
No, that's great. So I think in thinking about the treatments, you want to know, what you're getting into and the niches that might help you and what you should watch out for. So obviously a medication that's going to injure your liver, you want to stay away from. So that medication is called methotrexate. So if you're put on methotrexate and you're drinking a lot of alcohol, you could go into full liver failure. Now, these side effects occur, but the paradigm for treating rheumatoid arthritis has greatly changed. So we used to think that in the treatment of immune suppressive autoimmune diseases, you needed to have an immune suppressing medication, which, for lack of a better term, carpet bombed the entire immune system. And it did so in a kind of imprecise way. We're in a golden era right now in which we have biological medications. So what that means is these are medications that were devised from microorganisms in the laboratory. And with just amazing and exquisite specificity, they could target specific pathways. It's not like the carpet bombing of the immune system. So let me give an example. The first medication like this that was developed, they're called tumor necrosis factor inhibitors because they recognize that this protein called tumor necrosis factor can excite and lead to joint pain in rheumatoid arthritis. So what these new biological medications do, and it's really amazing, they precisely mitigate the effect of a target on the immune system. So we go after relevant pathways with much better specificity than we used to be able to.
Now, if someone has, you said there was a genetic piece, an environmental piece, and then other things that we could do that are triggering these events where now we're into this cascade and we're going into autoimmune disease. But if someone knew that they had the genetic connection there, someone in their family, someone in their past has suffered from autoimmune diseases, what are some things that we can do to basically protect ourselves, to prevent getting into that situation in the first place?
Sure. So the one thing I want to emphasize is that you might have a genetic predisposition, but a lot of people who don't have this genetic predisposition will never develop rheumatic diseases. So then the next question is, what can we do to prevent rheumatic diseases? And just to give rheumatoid arthritis as an example, with rheumatoid arthritis, when you come in, you need to have joint swelling. If you don't have joint swelling, you can't have rheumatoid arthritis. And then the other aspect is that there are certain antibodies that are associated with rheumatoid arthritis. So let's say you're in an earlier era in which you have joint pain without swelling and you have these antibodies. So you're likely in the next several years to develop rheumatoid arthritis. So what can we do to lessen the risk that you'll develop rheumatoid arthritis? And I think that that's an exciting area of research, but we haven't solved that conundrum, so to say. So for patients who have a predisposition toward developing rheumatoid arthritis, we've tried treatments. Those treatments haven't worked yet to prevent. It can delay onset of rheumatoid arthritis, so you can have more time before developing it. But I think that's going to be a hot area of research in the next 5-10 years, thinking about this and how we can prevent autoimmune diseases from developing.
Yeah, I'm a big fan of prevention.
Yes.
So, doctor, I define wellness as being the healthiest, fittest, and happiest you can be. What are 3 strategies or tactics to get and stay well?
Sure. So the first strategy, I think, is to recognize and treat depression. So what happens is, in the context of physician-patient interactions, depression is sometimes deprioritized. And because in the pressure of a visit, if your physician might ask, like, do you have joint pain? Do you have a rash? But what often goes diagnosed is like underlying depression. And the reason depression might be underdiagnosed is because it's thought to be tantamount to sadness. But depression is so much more than sadness. Depression causes pain. Depression hurts. Depression can cause fractured sleep. It could cause appetite to increase or decrease too much. It can cause you to withdraw from family members or from preferred activities that bring you joy. So I think with better recognition of how depression can present not only with sadness, but with a lot of other symptoms, it could be more effectively diagnosed. And then there are benefits of that is when you treat depression, a lot of times you have a huge impact on being able to benefit your overall health. So I think recognizing and treating depression. The second thing is, I'm sure you and your listeners will think about is optimizing diet and sleep hygiene also. And then the third thing that I think I emphasize in my book is empowerment. And in a sense, this book is all about like autoimmune empowerment. So what you can do. So the very act of advocating for yourself puts you in a position where you can help yourself and your autoimmune diseases. So it's empowerment as to diagnosis, challenging your physician. Why do I need 15 tubes of blood being drawn? Empowering yourself as to decisions about treatment, like why do I need to be potentially exposed to certain side effects? So I think these are the 3 facets. I think aggressive diagnosis and treatment of depression, optimizing diet and sleep, and becoming a more effective self-advocate for yourself. I think that can holistically improve your sense of wellness.
Yeah. And I have to say, I think this book is a great tool for you to be that self-advocate, because if you're kind of going down the line and you suspect that you or someone else has an autoimmune disease, this book is going to get you primed to know exactly what's going on, what the current treatments are, what some of the side effects are, some of the things you'll need to do or know about before you get engaged with it, because there's some pretty pretty heady things in there, like blindness and liver damage and things like that. So I think having a book like this is a great resource to help someone make the right decisions and ask the right questions. So thank you for this book.
No, thank you. I mean, and I think the one thing that I wanted to do in this book is I didn't want to patronize readers. So I didn't want to not delve into the scary complications that can occur, because I think that's important to be transparent. And I think readers want to know about this, because then it becomes even more important to say, well, what can I do in terms of treatment so I could prevent the more scary complications?
Yeah. And so the 7 minutes that your doctor has to talk to you, you're going to know a lot more. So it's going to be a much more valuable conversation going in there than trying to catch up from ground zero with not enough time to really get the information you need to make the right decisions. So again, I think it's an awesome book. So, Doctor, if someone wanted to learn more about you, learn more about the book, Living Well with Autoimmune Diseases, where would you like for me to send them?
Well, I think that my website, which is juliusbirnbaum.org, is talks about the book and links it to where it's being sold, for example, right now on Amazon and Barnes and Nobles. So I think those are resources. But the website also talks about the purposes of the book. It talks about how I want to engage readers. So again, it's juliusbirnbaum.com. And the book can also be looked at. It's being sold on Barnes and Nobles and Amazon and sites like that.
All right. Thank you for being a part of 40 Plus Fitness.
Oh, no, thank you for having me. I appreciate it.
If you enjoy